of the plastic holder. After reinserting the canister into the inhaler, remove the cap from the mouthpiece and insert the inhaler into the wide slot end of the spacer. Spacers assist clients to inhale the complete dose of medication. Prepare the medication by vigorously shaking the device and hand the inhaler to the client. Ask the client to breathe out through their mouth and depress the medication canister to dispense the medication into the spacer. They should take a long, deep breath to inhale the medication and hold it for 10 seconds. If the client is unable to take a deep breath, have them take 2 to 3 short breaths to inhale all the medication from the spacer. Wait at least 1 minute before repeating the procedure if more than 1 metered dose is required. Another method of using a metered dose inhaler is to have the client hold the medication canister in front of their mouth without a spacer. Instruct the client to exhale completely while holding the canister 1 to 2 inches away from their mouth. They should inhale deeply while depressing the medication dispenser and hold their breath for 10 seconds before exhaling. A third method is to have the client place the inhaler mouthpiece into their mouth, sealing their lips around it. As they inhale, they should depress the canister and continue inhaling slowly and deeply, holding their breath for 10 seconds to allow the medication to be absorbed. Whenever inhalers or spacers are used, you must clean their mouthpieces with alcohol wipes, recap all the devices, and store them until the next time the inhalant medication is to be administered. Once used, the metered dose inhalers and the spacers can only be used by the same client. When you are finished, remove your gloves and wash your hands. Please pause for review and practice. Transdermal or medicated patches are self-adhesive and applied directly to the skin to slowly release a medication that affects the whole body or has a systemic effect. After checking that you have the right medication and the right dose, open the package to remove the patch. Always put on clean gloves to keep the medication from coming into contact with your skin. This will prevent you from accidentally receiving a dose of the medication. The patch may stay in place for a few days or for several weeks. Check the MAR to determine which medication patch is to be given, where it should be applied, and how long it should stay on. Write the date, time, and your initials on the patch before placing it on the client. This allows anyone caring for the client to readily see when the patch was applied. Remove any previous patch of the same medication to avoid giving the client too much medication. You must also rotate where you place the patch on the client's skin to avoid skin irritation. Before applying, bend or fold the patch. This will make it easier to remove the protective covering. Remove only 1/2 of the adhesive covering and place the patch in the desired location. After smoothing down the first half of the patch, remove the second half of the adhesive covering and smooth the remaining portion of the patch to the skin. To ensure that the client receives the full dose of the medication, be sure that the patch is completely adhered to the skin. When you are finished, remove your gloves and wash your hands. Please pause for review and practice. Topical medications are designed to treat affected areas of the skin. Topical medications come in several forms, including ointments, lotions, pastes, creams, powders, sprays, and shampoos. Always introduce yourself when you enter the client's living space. Because you may come in contact with the medication and body fluids, always put on clean gloves before administering topical medications. If you do not have a suitable workspace, you can create a clean workspace by laying down a paper towel. When removing a lid or cap from a container, always turn the lid up to prevent the inside from picking up germs. When applying topical medications, you should only apply a thin layer unless instructed differently on the MAR. You may use sterile gauze or a cotton-tipped applicator to apply the medication. When using a gauze bandage, apply the ointment to the gauze instead of the wound using a sterile tongue blade. This will prevent irritating the wound. To avoid contaminating the ointment, do not reuse the tongue blade. Remove the old gauze and discard it. Apply the gauze and secure it with tape. When you are finished, discard the used supplies and your gloves in the trash. When applying topical medication to a small area, use a sterile cotton-tipped applicator or sterile gauze. Again, discard the used supplies and your gloves in the trash when you are finished. When applying powder, sprinkle it lightly and evenly onto the affected skin. Wearing gloves, gently rub in the powder if needed. Be careful not to inhale the powder dust. When you are finished, remove your gloves and wash your hands. Please pause for review and practice. Vaginal medications come in several forms, including creams, tablets, and suppositories. These medications dissolve at body temperature and are absorbed through the wall of the vagina. Check the MAR to determine which medication is to be given. Because you may come in contact with vaginal secretions, always put on clean gloves before administering vaginal medications. Position the client with her knees bent and spread apart to prepare for medication administration. Always provide privacy for the client. Special applicators are needed for inserting suppositories, tablets, and creams into the vagina. Suppositories and tablets use a similar applicator. If the medication is foil wrapped, remove the foil before placing it into the applicator. Gently pull back the plunger before putting the medication into the applicator. Lubricate the vaginal suppository or tablet to allow for easier insertion. Using your non-dominant hand, spread the labia or lips of the vagina. With your dominant hand, gently insert the applicator and depress the plunger to insert the vaginal suppository or tablet into the vagina. Because the applicator is used over and over for the same client, place the used applicator on a paper towel and wrap it up. Remove your supplies, remove your gloves, and wash your hands. Make the client comfortable asking her to remain in bed for about 30 minutes to allow the medication to be absorbed. Put on a fresh pair of clean gloves and take the applicator to the sink. Wash it thoroughly with antibacterial soap. Then rinse and dry it. Wrap the clean applicator in a new paper towel and store it according to your agency's policy until it is needed for the next dose. When you are finished, remove your gloves and wash your hands. It is important to wash your hands before and after administering vaginal medications. Please pause for review and practice. Rectal medications are used to treat local inflammation and systemic symptoms and come in the form of suppositories or enemas. Suppositories are semi-solid, oval-shaped medications that dissolve at body temperature and are absorbed through the lining of the rectum. Check the MAR to determine which medication is to be given. To keep suppositories firm, they are often kept refrigerated. Check the MAR for the right client, the right medication, the right dose, the right route, and the right time. Wearing a clean glove, remove the correct number of suppositories from the medication canister and place them in a medication cup. Wearing a glove prevents you from introducing bacteria into the canister. Return the suppository container to the refrigerator. Gather needed supplies such as lubricant, absorbent pad, and gloves before approaching the client. Always introduce yourself when you enter the client's living space. Be sure to provide privacy for the client before you begin. Identify that they are the right client and tell them why you are there. Position them onto their left side with their right leg slightly bent. Place an absorbent pad under the client and cover them to provide warmth and added privacy. It is important to wash your hands before and after administering rectal medications. Because you may come in contact with feces, always put on clean gloves before administering rectal medications. Hold the suppository between your fingers and apply lubricant to the suppository. This will aid with insertion and prevent discomfort. Gently place the tip of the suppository against the rectal sphincter and push the suppository into the rectum as far as your finger will reach. After inserting the suppository, use both hands to squeeze the buttocks together. This will assist the client with holding in the suppository. Some suppositories come individually wrapped in foil. Wearing gloves, remove the foil and hold the suppository between your fingers to apply lubricant. Gently place the tip of the suppository against the rectal sphincter and push the suppository into the rectum as far as your finger will reach. Use both hands to squeeze the buttocks together to assist the client with retaining the suppository. When the suppository is used to help the client empty their bowels, be sure to ask the client not to flush the toilet until you have had a chance to check the results of the suppository. If they use a bedpan or bedside commode, check the results before disposing of the contents. Enemas are used to deliver medications or to assist the client with emptying their bowels. Enemas may be prepackaged or prepared at the bedside. After gathering the supplies needed to administer an enema, you will once again need to put on clean gloves. Remove the cap from the applicator and gently insert the pre-lubricated tip into the rectum. Slowly roll the pre-filled bottle, folding it from the bottom to the top as you squeeze the enema fluid into the rectum. Be careful not to push on the rectal wall. Carefully remove the applicator tip from the rectum and squeeze the buttocks together for a few seconds until the client's urge to defecate passes. Place the client on the bedpan. Give them toilet tissue and leave the call button within their reach. Ask them to retain the enema as long as they can and to call for you when they are finished. When an enema is used to help the client empty their bowels, be sure to note the results from the enema before emptying the bedpan. When you are finished, remove your gloves and wash your hands. Please pause for review and practice. These are additional medication administration guidelines that medication aides should know and follow. Some clients have conditional restrictions regarding their medications. For example, certain medications may not be given if the client's blood pressure or pulse is too low. Always check the MAR to determine if any of your clients have restrictions that you need to be aware of before administering their medications. Your agency will direct you on how to handle these situations. Protect your client's dignity by respecting their privacy. By law, you must protect the privacy and confidentiality of your client by not allowing visitors or other clients to know what medication your client is taking. When administering medications, especially topical, vaginal, or rectal, provide privacy for your client by shielding them from others with a curtain or door and by covering them when necessary. Stay focused. Once you begin administering medications, do not stop unless there is a life-threatening emergency that demands your attention. If you must leave the medication cart, remember to lock it. Avoid giving medications in public places such as dining rooms or hallways. The chance of making an error increases in these kinds of environments because it is easy to get distracted and make errors. Let's review the key points of medication administration. As a medication aide, you should always prepare your workspace and gather your supplies so that you can stay focused on the task of medication administration once you begin. Protect your client's privacy. You are required by law to keep their personal health information confidential. Practice proper hand hygiene at all times to protect your clients and yourself. Always refer to the Medication Administration Record, or MAR, when administering medications. Never give medications from memory. Always follow the 6 rights of medication administration. Remember, following the 6 rights means that every time you give medications, you are making sure you have the right client. Give the right medication. Give the right dose. Use the right route. Give the medication at the right time and provide the right documentation. Following these guidelines and practicing the 6 rights will help ensure safe and accurate medication administration for your clients.